Now vaping, what parents need to know.
According to the FDA, more than 2 million middle and high school students used e-cigarettes in 2016, and the use among teens is rising.
Doctors say these devices, sometimes marketed as a safer alternative to cigarettes, still pose risks.
Eyewitness News reporter Patrick Little is here now with the important information you need to know.
E-cigarettes have been around for quite a while, but it wasn't until I had a conversation with my teenage son that I started to realize just how many kids his age seem to be using them or at least trying it.
Definitely out of control.
Vincent Turchetta is the Dean of Students at Mount Hope High School in Bristol. He says his district, like many others around the state and the country, have seen a disturbing increase in the number of high schoolers using e-cigarettes, or vaping as it's more commonly known.
It is a craze.
Vaping is just as addictive as tobacco cigarettes. The problem is it depends a lot on the nicotine content in the vape juice. We often have no idea how much nicotine is in these products.
We checked the most recent data from the Department of Health. In 2015, more students used e-cigarettes than any other tobacco product. Dr. Jack Rusley, an adolescent physician at Rhode Island Hospital, says that's due in part to how easily available e-cigarettes have become.
So it's much more available and much easier to get than traditional tobacco cigarettes. You know, in schools, it's much more difficult to sort of smell these products.
Which brings us back to the issue of catching kids vaping on school grounds. As of early November, there were only 2 instances of students being caught at Mount Hope this year.
Do you think if you looked for it, you'd find more?
Probably.
You think that might become more part of your job eventually?
I hope we get the word out there. I hope our kids, become more educated. We confiscate the paraphernalia, which is very expensive, by the way. But then what we do is we refer them to a substance abuse counselor.
We reached out to the Tobacco Vapor Electronic Cigarette Association, an international trade group that provides information on e-cigarettes to media, lawmakers, and e-cigarette users. They tell us they're 100% against underage vaping and say they're pushing for a national law requiring age verification for anyone buying vaping products. They're also against e-cigarette flavors that appeal to minors like bubblegum or cotton candy.
The chemicals that they're inhaling in their body, I mean, it's ridiculous.
And they have no idea.
They have no clue. They think it's a safe alternative to smoking cigarettes, which is pretty sad to me.
Now, the E-Cigarette Association also says that electronic cigarettes are, quote, vastly less harmful than tobacco, and that vaping has played a major role in the decline in conventional tobacco smoking in recent years. I'm Patrick Little, Eyewitness News.
New details in a story we brought you live at 5. Vaping, what parents should know. At 5, we told you about the growing popularity of e-cigarettes among teenagers.
And new at 6, a local doctor sounds the alarm about chemicals that could be lurking in those e-cigarettes. Eyewitness News anchor Patrick Little has the details.
We now know some of the statistics about the number of teenagers using e-cigarettes, but what doctors are researching now is the effect the chemicals in these e-cigarettes can have, especially on a teenager's brain that's still developing.
The important thing to realize is just because, kids aren't getting caught, there is a problem.
Vincent Turchetta, the Dean of Students at Mount Hope High School, says the vaping craze is out of control with high school kids. The newest data from the Department of Health backs him up. E-cigarette use by children under the age of 18 has surpassed the use of regular cigarettes.
The analogy that I use is that it's a little bit like putting a bomb in your mouth. With tobacco cigarettes, we kind of know when the bomb is going to go off and how big the bomb is. With vaping, we have no idea.
Dr. Jack Rusley, an adolescent physician at Rhode Island Hospital, says many of the chemicals used in vaping still aren't known, but those that are known are alarming.
Some of the things that have been detected are polyethylene glycol, so other things that are components of things like antifreeze, things that have been known to cause cancer in animals.
A new law went into effect in Rhode Island last month banning e-cigarette use on school grounds. It also requires child-resistant packaging for the liquid nicotine used in e-cigarettes.
Young children who find these vape juices lying around the house and drink this stuff because it's bubblegum flavored, candy flavored. There's actually been a couple case reports of children dying from nicotine overdose.
At Mount Hope High School and other schools, the risks associated with vaping have now become a part of the curriculum of health education classes.
I think the important piece is what happens after an infraction happens, what you do and what you say.
There certainly is evidence that vaping is harmful. I think there's more evidence that needs to be gathered around what it can do to teenage brains. We know that nicotine can impact a developing brain in a negative way.
According to the Centers for Disease Control and Prevention, e-cigarettes are now the most commonly used tobacco product among America's youth. They generally contain fewer toxic chemicals than regular cigarettes, but studies have shown some e-cigarette flavoring could contain chemicals linked to lung disease or heavy metals like nickel and lead. I'm Patrick Little, Eyewitness News.